Hello everyone, my name is Maoyi. I'm from School of Public Health of Harbin Medical University. Thank you for the opportunity to present at this very important research seminar today. It's a shame that I couldn't attend in person. My presentation today will be talking about the falls prevention in China. Before we just talking about falls, if we just look at the aging trend in China, we can clearly identify that over the past 2 decades, China is aging really rapidly. Based on the seventh national census data, that in 2030, there will be about 400 million people aged 60 years old and above. So that's representing about nearly 20% of the entire population. One of the consequences for the aging population, and it could be as a most neglected health conditions, is about falls. So when we're talking about aging, most people will be thinking about cardiovascular diseases, diabetes, but falls is always being neglected in most health services. But if we're looking at the global burden of disease data, fall remain as the leading cause of injury-related mortality among the older people. And we recently conducted a study to estimate the burden of falls in China by using the global burden disease data. This study has been published in 2021 in Lancet Public Health. And from this study, we found there's a large variation in terms of the estimates of the incidence, mortality, and deaths from the previous literature. And this study is basically to investigate the current burden of falls among the older people at the national and the provincial level in mainland China, and also to explore the trend in terms of the burden of diseases from 1990 to 2019, and we used the global burden of disease data 2019. And from this study that we can clearly identify that in 2019, the incident rate, mortality rate, and death rate, they are pretty high in people aged 60 and older in mainland China. And also, if we're looking at the trend between 1990 and 2019, there's a substantial increase in the incidence rate among the older Chinese adults from 1990 to 2019. If we're looking at the burden of falls by sex, in terms of female and males, both sex, they experience a pretty large burden in terms of the incidence, mortality, and deaths among the females and the males for people aged 60 and older. And if we compare females and males, we can also clearly identify that males experience a higher incidence rate and mortality rate compared to the females. So from this study, we concluded that between 1990 and 2019, the incidence rate of falls increased substantially in older adults across the mainland China, and falls remain as an ongoing health burden for older people in China. And there is an urgent need to introduce system-wide, integrated, and cost-effective measures to protect or to intervene the older people that can minimize the risk of falls. So following this study, we started to identify what are the current system-level barriers that prevents the evidence-based falls prevention interventions into the existing Chinese health systems. Since 2009, Chinese government started to implement a national program, and this program is called National Essential Public Health Service Package. This package program is being implemented at primary healthcare system levels with the aim to improve the current management of non-communicable diseases as well as on targeted population, including the older people. And as part of this National Essential Public Health Service Package, people aged 65 and above, they are required to provide health checkups on an annual basis, and also falls prevention is part of the program. So in this study, we're trying to identify what are the associated factors that being associated by implementing the false preventions in Chinese primary healthcare system. And in addition to that, we're trying to provide recommendations to inform the future better implementations of false prevention in the Chinese primary healthcare system. So this study is a qualitative study and conducted in 3 provinces, and we interviewed multiple stakeholders that including the health administrators, primary healthcare providers, as well as the older people. And we used the consolidated framework for implementation research to inform the development of the interview guide, as well as to help us to analyze the data. So we totally interviewed 130 participants, and we clearly identified there are multiple barriers to implementing the false prevention in the Chinese primary healthcare system. So those major barriers include insufficient confidence in delivering the interventions by the primary healthcare providers, and there is a really poor understanding of the false burden of the primary healthcare providers. In addition to that, low recognitions of the importance of false prevention and limited multi-sectorial collaborations and weak financial incentives, they are all identified as major barriers from the primary healthcare providers. So from this study, we concluded that there is a need to better integration with the National Essential Public Health Service package to provide system integrated false prevention program in the Chinese primary healthcare system. So based on this study, we further conducted a participatory design with the aim to develop intervention framework to strengthen the integration of false prevention for older people within the Chinese primary healthcare system. And this study, we're using a participatory design approach with a wide range of stakeholders. So again, this study has been designed as a qualitative participatory design, and we conduct this study in 3 provinces. And those participants include the health administrators, public health professionals, as well as primary healthcare providers. We designed this study as 2 stages. In each of the stages, there are 2 workshops. In stage 1, the first workshop is trying to understand the service procedure and to identify the opportunities for integration. And the second workshop of stage 1 is to optimize the integration within the local primary healthcare system. And in the stage 2 of this participatory design, the first workshop aims to refine the participants' understanding of how to strengthen the integration. And the last workshop is to develop the specific implementation strategies. So at the end, we identified there are 5 key components in this conceptual framework. So that including the policy, service, workforce, data, and organizations. And in each levels of this framework, there are also specific implementation strategies being proposed by the multiple stakeholders. So for example, in the service component, the participants basically recommend to add to service for patients with diabetes and hypertension to be integrated with their routine management for hypertension and diabetes program, and also to be integrated into the traditional Chinese medicine service, and also has the potential to integrate with other potential services. So basically, rather to provide the false prevention as a standalone service, but to consider the integration of false prevention with the existing health services, including hypertension, diabetes, and other existing health services. And also other specific implementation strategies like for the workforce, that including to provide in-service training and also to consider task shifting by involving non-professional healthcare workers be part of the service deliveries. So for the other components, there are also specific implementation strategies for organization, policy, and data. Based on the previous studies, by understanding the burden of false, understanding what are system barriers of implementing false at the primary healthcare levels, and also to develop a conceptual framework to implement false prevention at the primary healthcare levels. So based on the results of the previous studies, we are now conducting a false prevention trial So this is a cluster randomized control trial be implemented in 128 rural villages from 4 Chinese provinces with a total sample size of 2,500 older adults. So in this cluster randomized control trial, we aim to evaluate the effect of strength and balance training program on the incident falls among the older adults. So we have completed the recruitment and baseline survey. The intervention started from January 2024 and due to complete by the end of next month. So hopefully that at the next opportunity, I can share some main results from this falls prevention trial from 128 villages. So at the end, thank you very much again for this opportunity to share and present our work in falls prevention, and we look forward to future opportunities in collaboration in this area. Thank you.